And the next speaker, it needs very little further introduction, is Dr. Robert Mathie from the United Kingdom here, and he is, of course, an influential researcher in the field of homeopathy and summarizes the evidence, and he will improve on the poor contributions by Dr. Kuchrat and Zhang and make this better. So I'm very anxious to hear what you have to say.
Thank you very much, Robert. Well, good afternoon, everyone. How nice it is to be back at an HRI Congress, and how nice it is to be in sunny London. So this is a synthesis of 10 years' work. And the systematic review and meta-analysis program that I think you're probably all aware of is what I'm going to summarize in no more than 20 minutes. So there'll be big gaps, methodological details that I can't possibly go into, but which are all in the public domain in the published work, or which we can talk about afterwards. The first critical thing to do is to acknowledge and gladly recognize the 24 collaborators that I've gladly worked with over the last 10-year period. And you know many of them, many of whom are here in this audience right now, and some who aren't, who are either tragically no longer with us, or who are my statistical colleagues at the University of Glasgow. And the other thing I must acknowledge, and pleased to do so, is that the majority, but not all of the work, took place during my tenure of employment at the British Homeopathic Association, without whose enthusiastic recognition of the importance of the work, it would have been difficult to do. And the other thing in terms of financial support was from the Manchester Homeopathy Clinic, which closed its doors but which redistributed its funding in a charitable way, and I was one of 2 recipients of that money. So take your minds and souls back 10 years. At the BHA we had put together a synthesis of the evidence that was based not so much on systematic review, but on a clear analysis and interpretation of the literature from a sort of anecdotal but scientific basis. And we knew about the Shangs and the Lins and so on, and that 4 of the 5 of that type of review were broadly positive. 1 was negative, which we don't need to rehearse more. We also knew that in terms of condition-specific research, RCT research, 5 of the 17 conditions that have been studied in that way showed positive evidence, and 3 were negative. At looking at the overall literature and analysing how positive or otherwise the studies concluded, then we recognised that nearly half, 44% of, at the time, 142 peer-reviewed RCTs were positive, had a clear positive finding statistically, and 8 of those were negative. So the balance of forces was in our favour from the homeopathic perspective. But this was on the back of the Shang report and all its deadly aftermath, and it was on that basis that the House of Commons, situated a mile to our west here, its Science and Technology Committee decided to investigate homeopathy from their perspective. And they called it an evidence check 2. And Peter Fisher and myself and some others, Ernst Ernst and some others on the other camp, sat in a committee room along the road and were faced by a hostile committee whose starting point was one of refusal to believe that there was any evidence. Not unfamiliar. So when they asked the question, the pointed question, the critical one, about high quality, what is the high quality evidence that homeopathy shows any efficacy beyond placebo effects, given the Shang was still in the headlights, Lind was now some years old, and despite the fact that we had looked at this sort of analysis and knew this factually and honestly and truthfully, it was actually rather hard, and in fact it turned out impossible, to defend and make a statement that that committee in the bottom line of the report were going to take on board. And it was a dilemma that was disconcerting and alarming, because we who knew the evidence and could point to some trials that were positive, and we did so, there was a refusal to accept that that was true. So we were therefore in this analysis, this whole program is about truth, clarity, objectivity, and honesty. So we embarked on a program whose aims were to review the entire evidence base of RCTs and homeopathic treatment, and to focus especially on those with minimal risk of bias and their meta-analysis. Now, if one has to stand up and account for a method of medical treatment, it must be based on the highest quality evidence that's worth something, which is why all reviews, properly done as ours has been, do end up with a rather small number of studies, because not all of them are excellent. Only a small proportion would be expected to be excellent, which is exactly the same in the conventional medical world. One of the key attributes which most of you know in this whole system of work is that unless we are sure in our minds that those papers in the reports have used homeopathy that is up to standard, then we are in a weak position of knowledge and appreciation of what the evidence truly is. So we, when I say we, an international research group that was chaired by Peter Fisher, we set to and identified a means of assessing the model validity of randomised controlled trials, which means assessing the excellence of homeopathy delivered to the patients as best we could see it from the papers, and the appropriateness and suitability of the outcome measures and endpoints used in the studies. And in terms of studies of a more pragmatic nature, those that typically do not use placebo as the control group, in a whole different series of studies, most principally with Peter Viksveen, who used to be within the homeopathic community, is back now in his home country of Norway in a more conventional line of research. We set to and identified a method of measuring the external validity. How generalizable are the data in a wider defined population of patients? So, big program, and you may, what I'll just do, you may want to photograph, for those of you who want to know the details. These are the 7 principal papers that emerged from the study. The one that's mostly flagged, and I'm glad to say is the critical one, is the paper we published in Systematic Reviews 5 years ago, because it's on individualized homeopathic treatment and it compares against placebo. And the fact that that result was positive, which I'll of course come back to, is fundamentally critically important to the future of homeopathy. The studies on the lower end, lower side, are those on model validity, which were allied to those and separately analysed in the different series, but then brought together as a whole. So the quality assessment, we wanted to use standard and standardised tools where they were available, so that we had recognition in the wider domain of scientific interpretation of our findings. So for all the trials, we used the standard Cochrane risk of bias tool, which is about randomization and allocation concealment and blinding and so on and so forth. I can give you more details if you needed it. But critically, for placebo-controlled trials, those that were eligible, we assessed the model validity with our method and attributed with the combination of the model validity score with the risk of bias score. I didn't quite use the word score rightly, but I hope you know what I mean. That we bring together a final assessment of a given study based on both risk of bias and model validity of that given study, and we attribute an overall characteristic of low quality, moderate, or high quality evidence. And we finally examine the evidence that is highly reliable based on the latter. In terms of the non-placebo controlled trials, we examined external validity in the way I've mentioned, using the method called the Précis method, which is about the degree to which a randomized controlled trial report gives evidence of it being an explanatory one rather than pragmatic, or vice versa. There's a continuum of study attitude which starts from the absolutely explanatory, that would be placebo controlled typically, and which has everything is tightly controlled, to the other extreme that there's much more liberal approach to patient selection and many other attributes that make it recognizable as a pragmatic attitude study. And we then interpreted those studies that are clearly pragmatic also in the category of highly reliable evidence. So this is a screenshot from the paper published in 2014 in Systematic Reviews of the individualized homeopathy studies against placebo. And this uses the odds ratio in the standard way that Robert was discussing, and done the proper way round, where homeopathy is to the right and placebo is to the left. So an odds ratio of greater than 1, and with a confidence interval that does not overlap that line of unity, is a treatment effect that means there's a statistical significant effect of homeopathy compared with placebo. And the bottom line of that overarching analysis, showing all the studies that were eligible of individualized homeopathic treatment and placebo control, showed an odds ratio of 1.5. So it's about 1.5 times the likelihood of homeopathy having an effect than that of placebo. So that the bottom line of that study, and I'll come back to the refinement in terms of highest quality, because this is all the studies that were eligible, was positive. And so was the much bigger analysis of 72 studies of non-individualized homeopathic treatment compared with placebo. That was the subject of a study that took 3 years to go through analytically, and then ultimately publish again in Systematic Reviews in 2017. And this time, just to confuse you, but not deliberately, and I do apologize, the statisticians I was working with felt it was actually much better to label treatment effect with something called a standardized mean difference, which actually has a value that can be interpreted more meaningfully to a patient than an odds ratio, which is just a probability thing. A treatment effect, and this time homeopathy effect towards homeopathy, is to the left, and the placebo direction is to the right. So the bottom line, however, with the pooled data, show a statistically significant treatment effect size that's different from placebo, and that effect size is something like minus 0.3, which would be deemed to be a small effect size akin to an odds ratio of about 2. So that's the overarching view of the non-individualized trials. This was just showing it in a rather bigger detail, magnified so you can see these values, because with 72 studies to deal with, it took up a full page of the published paper. So there's the treatment effect size of minus 0.33 in favor of homeopathy. So now we begin to sift through the evidence in terms of the highest quality and the most reliable evidence, and have defined how we regard reliable. We're actually the only group in the literature properly to define reliable evidence, which is that in terms of homeopathy, there has to be a very low risk of bias intrinsically within the study, and that the homeopathy is good. So these are the studies in chronological order from 2014 to this year. The numbers in the reviews varied in the way I've said. There's actually a very small, tragically small number of other than placebo-controlled studies in the literature. The number in the meta-analysis that became eligible for a whole raft of proper reasons that I can't go into brings the total that were actually meta-analysed to 90 in total over the 4 papers. And these are the studies in each of the 4 papers that qualified as having minimal risk of bias, 13 out of 90, which is a rather typical number of studies that finally achieve a certain gold standard where you could stand up and feel you could shout about the results rather than whisper them. This is even beyond that, where you have a megaphone to shout about them, because this time we're looking at only those that have the model validity or the external validity analyses brought into play. For example, there were some very good studies here, especially in the non-individualized homeopathy group, whose model validity was very poor. Single remedy studies that were actually unwisely decided upon by the original experimenters in the view of our model validity assessors. So these are the 13 studies, and those that are highlighted in green are those of the 5 that have this, the extraordinarily highly reliable evidence that if there was an evidence check 3 from the committee along the road, these are the ones that we would be highlighting and shouting about and saying this is the evidence for homeopathy from our randomized controlled trials, if objectively and analytically achieved. But I suppose the thing to highlight is that necessarily it's an eclectic mix of medical conditions that have been examined. Fibromyalgia, diarrhea, acute otitis media, point that Liz made, Jennifer Jacobs' work typically and rightly as in acute conditions, menopause and IBS. Now this is the meta-analysis of all the placebo controls that we can regard as having minimal risk of bias. And you can see, this is back to odds ratios now, favouring homeopathy to the right-hand side. Bottom line is a significant difference of homeopathy compared with placebo, with an odds ratio of 1.7. Always seems to be in this 1.5 to 2.0 odds ratio range. So every single study, but 2, actually are positive, although only 1 or 2 actually in themselves are positive. The pooled effect, which is why you do the meta-analysis, to increase the sample size and therefore pooling the data to get a firmer statistical finding, it's highly significantly positive. Now, just to sort of complete the picture, those that other than placebo-controlled trials, where comparing with something else, the 2 studies that qualified are those by Weiser et al. And now here, these are both equivalence studies. So the null hypothesis is different there. You're actually expecting, if you like, to see no difference. And there was no difference when you pooled the analysis of his 2 papers. And then the only single study of other than placebo-controlled that wasn't an equivalence study that qualified for an analysis was Peckham et al. On IBS, and actually their treatment effect was minimally towards homeopathy. It's a one-off finding. So to summarize, we have 131 papers to begin with. The minimal risk of bias evidence comprises 13, which is 10%, is a significant number, and it includes critical evidence of a distinct effect of homeopathic medicines compared with placebo, with an odds ratio of about 1.6, 1.7, and although the sample size is really small, that there is evidence that homeopathy is at least equivalent or similar to that of a conventional medicine for the given medical condition. And what I want to do now is focus on, this is really the take-home message. And please don't go away with the feeling that there's only 4, this is bad. This is not bad, this is fantastic, because we have 4, and they are unequivocally robust. They unequivocally have a positive finding, pooled across the 4, and they unequivocally have excellent homeopathic treatment of the patients contained in the study. You would not expect many more than this out of 130. To have this is something to stand and shout about and defend homeopathy to the hilt. So that's the summary of that same statement. The odds ratio associated with this is about 2, and that's also familiar. Take home the message that an odds ratio of 2 means the homeopathic treatment effect can be seen to be twice that of placebo, or expected to. The odds of it, the homeopathy being effective are twice that of placebo, to say it more precisely. So, overarching conclusions, we have 13 studies with minimal risk of bias, of which 5 have truly reliable evidence that we can shout about, that they comprise robust statistical evidence of a distinct effect of homeopathic medicines, whether individualized or non-individualized, but the bulk of the evidence is in individualized homeopathic treatment, critically. Not unfamiliar bottom line. Of course we need more research. All studies in the world end with this statement. It is true here. And if we achieve that, and the study that Liz highlighted that we published in the journal this month, you know, non-individualized treatment of menopausal symptoms with an original pepper-based remedy. Excellent study and positive. That would be in that highly reliable evidence synthesis in a future updated meta-analysis. So those and other studies coming through, when these studies, heaven help us, these meta-analyses are done and updated in X years' time, then the evidence base will be bigger, firmer, stronger, and more importantly, contributory to homeopathic development. Thank you.